really pleased to be here this morning. I'm the global lead for the mental health strategy, and I look forward to presenting with my colleague Thanos, who I'll hand over to introduce himself as well. Over to you, Thanos.
Thank you, Christina. Thank you, Nana. I'm Thanos. I'm a psychologist by training, Thanos Hilvatidis. I'm working currently for WIPO, but I've come here in this session from my other hat as the co-chair of UNSCG, which is the United Nations Staff and Stress Counselors Group. And together with Nana, we will present the different streams and how we collaborate together, but also how we can provide support to our people. Thank you, Christina.
We should have also Lucia Vinti, but I think she's not been able to connect now.
She'll be joining towards the second half. She has an earlier appointment. Yeah,
okay.
She'll be. Thank you.
Fantastic.
But Lucia is the program coordinator for the mental health and wellbeing strategy team based in Bonn. So we work closely together.
Thank you. Please, you are free to start whenever you would like.
Sure. I'll just load my presentation and then I'll start. Do you see the presentation?
Yes, Nana, perfectly.
Okay, great. And just to let you know, there is some background noise, so I think someone just needs to mute their microphone. So once again, thank you very much for this opportunity to present on the mental health strategy. When we were formulating this meeting, we were told that what would be of interest is to give an overview of the mental health strategy, but also to really emphasize what supportive resources are there for staff that would help you in the context of your work. So I'll start with the first half of the presentation and then hand over to Thanos to share more about the work of the UN Staff and Stress Counselors group. So as I said earlier, I work as part of the global team that is in charge of implementing the UN system mental health and wellbeing strategy. So I'll say a little bit about that and then talk about the supportive resources and so on and so forth. So the mental health and wellbeing strategy, as you know, is a framework that we have in place, and it's also one of the Secretary General's priorities to ensure that the workplace remains harmonious and healthy and conducive to good mental health and well-being. And so we have a huge task there to really ensure that whatever we do, we're trying to achieve that objective of prioritizing workplace mental health and well-being. The UN, just like any other organization, would have no doubt staff members who are psychologically and physically well on duty. Perhaps also staff members who have mental health challenges and physical health challenges that are also active on duty, and also staff who maybe have become incapacitated due to either acute mental health challenges or physical health challenges while on duty. So the strategy in a way has to be very broad and inclusive to ensure that it really covers the whole spectrum of staff across the UN system. But ultimately, the aim is to ensure that we have a mentally healthy workforce, because that then pays dividend in terms of ensuring that our staff remain resilient, so able to sort of cope in the face of changes and transitions, and that they're also present and engaged to be productive in achieving their individual mandates. So I would always emphasize that the UN mental health strategy is a really important resource to be aware of and to really understand the different components of it. So it kind of goes beyond just really promoting the support elements of it, which often people think that it's just around counseling. So just to give you an understanding of the scope, so the global team for which I am part of, we help to sort of work in connection with various stakeholders to ensure that all the aspects of the strategy are implemented. So you can see here that the strategy is divided under three different pillars. So the mental health and wellbeing strategy aims to ensure that there's a lot of work that is done to even prevent poor mental health and well-being, and also an aspect of the strategy that is designed to really promote information and knowledge around mental health and well-being, and also the support element of it. So under the prevention aspect of the strategy, it's important to know that again, the UN, like any other organization, will have notable risks within the workplace, or what we call psychosocial hazards, that are often the cause of work-related stress and burnout. So it's important for the strategy to also understand, the strategy team, we're also working with others to increase understanding of the importance of being aware of what those risks are. For example, like work design, different working, long working hours, instability in the workplace, because they can all be detrimental to psychological well-being. And once we understand those risks, we can then have measures in place to manage those risks, to prevent poor mental health. The other aspect of prevention is also looking at some of our HR policies to ensure that they are not just present, but that they have elements in it that are conducive to promoting and preventing poor mental health. So are they inclusive enough as well? What about the use of language within those policies as in general? And often maybe ensuring that we review the way that policies are implemented, and we gain a perspective from the individual as to how those policies may be impacting on some of those processes within the workplace. Because as you know, some policies might be also detrimental to individuals getting access to the mental health support that they may need. The other aspect of prevention as well is manager education, because we believe in terms of ensuring that that knowledge is passed down from the top. And if managers have better understanding and knowledge about mental health, workplace mental health and well-being, that they can put those measures in place to really ensure that they take care of, first and foremost, their own mental health, and then that of their teams as well. And then under the promote part of the strategy, there's various initiatives, such as recently there was a rollout of mental health literacy training to ensure that mental health and well-being education is not just available for managers, but available for staff across the board. And the more that we're more conversant about workplace mental health and how we can protect that, then that puts us in a good position to promote that knowledge and understanding as well. The other aspect under promotion is also stigma reduction activities. Unfortunately, this is an area that we still could do better at, because there are a lot of stigma reduction initiatives, but very few that are focused on mental health stigma. But this is an area that the strategy team is really working on to try and ensure that we are targeting mental health stigma, so that everyone is more understanding of it, and those that require help can have less barriers in achieving what they need. And then, of course, on the promotion is ensuring that there is a number of well-being initiatives for staff to ensure that they are able to adjust to the demands of the workplace. And then finally, under the support angle, we have various things like the first one, enabling dignified work, taps into policy and practice. So really trying to understand what sort of provisions need to be in place to ensure that we can offer enable dignified work within the UN, but also whether there could be instances where individuals require reasonable accommodations and the support they may need to be able to fulfill their duties. And then number 8 on the support angle looks at really where the staff counselors and stress counselors come in terms of being able to provide that access to counselling. Under this aspect as well is also the topic of insurance, because people sometimes need insurance to be able to access mental health services. So we're really trying to look at how we can promote that equitable access to mental health and well-being services when needed for all across the board, so for both national and also international staff members. And then finally, under quality control, as with anywhere, it's important to have good psychosocial support, but we also need to ensure that there's quality control in terms of counsellors having the right qualifications and the right the right support systems in place to ensure that those who require it get it with no hindrances. You'll also notice there's a section here on cross-cutting factors as well. So these are really important enablers of the prevention and promote and support. So managers and senior leaders have responsibilities for championing the mental health strategy under leadership and really advocating for resources to support us in implementing the strategy as well. Managers and leaders also have responsibilities for reporting on the progress of the strategy and supporting the use of our scorecard. And the scorecard is basically a template or a model that we have in place to monitor how we're doing with implementation of the strategy as well. And then finally, we also want to ensure that the mental health strategy is not just a framework that we say is available for all, but we want to ensure that there is diversity in terms of perspective, lived experience within the working groups that are set up to ensure that we are truly being inclusive. So you can see then that the scope of the mental health and wellbeing strategy is quite broad. And in that respect, it requires the input of multiple stakeholders, being it the mental health professionals, HR leaders, medical, of course, staff representation, staff federation also play a key role in ensuring that we are able to achieve all of these areas. The other thing that I think is important for you to know as well, because you might have a question about how do we advance the implementation of the strategy to ensure that staff have the support when they need it. So we have 6 different working groups that have been set up with what we feel is diverse representation from all the UN entities. And those working groups cover stigma reduction, mental health literacy, psychosocial risk management, insurance, family support, and so on, and one on strategy and policy as well. So the working groups are really key in helping us to advance knowledge of the strategy, but also for us to ensure that the support that we say that we are offering is able to be disseminated across the board. So then I thought about that. What's then the linkage then, the mental health strategy and staff representation? I feel that you all play a valuable role in helping to be the bridge between what the staff need and the leadership. And you're in a great position to be in a unique position to also be able to support us in championing workplace mental health and well-being, and bringing to us or bringing to light some issues that in areas that we may not necessarily be aware of, or kind of giving us the heads up that this is an area that you're hearing more from the staff that really needs to be addressed, and so that really supports us in ensuring that we're not just that we're being mindful of the needs of staff rather than just what our mandate says that we should do as well. And I also think that you're in a unique position to help us in advocating for inclusive practices and effective policies, which I think is one of the areas that can often take a long time to ensure sometimes that someone is afforded reasonable accommodation due to like poor mental health or physical health as well. And I think you also play a key role in building the trust that's needed for staff to be oriented around the mental health strategy, and increasing awareness around for staff that there is support available across the board. So the key points then, I think, for you to take away is that the mental health strategy, of course, exists, and we're aiming to ensure that in the rollout of our resources that we're able to provide support for all no exclusions, regardless of duty station, regardless of your contractual obligations, that there's multiple stakeholders because it's a workplace mental health. It doesn't just require the input of psychologists or mental health professionals. Multiple stakeholders enable us to be able to be on track, on point. The mental health strategy, of course, is aiming to sort of transform the workplace culture to one that's inclusive and that really represents the needs of staff. And first and foremost, ensures that we are operating in a safe environment and one that really focuses on prevention rather than what I would say like medicine after death. So, and then we also aim to ensure that we have sustainable resources that are there for staff to ensure that they have better mental health and well-being as well. Additionally, the other point I wanted to highlight is that we constantly monitor the work that we're doing through various means because the data helps us in understanding areas that we need to improve on. For example, last year's scorecard taught us that actually we need to provide more support to the UN system in supporting them with developing mental health action plans so that they can begin to implement the strategy. And we need to do more on mental health stigma to ensure that that becomes a problem of the past. So just to tell you a bit more about the resources, so the Global Mental Health and Wellbeing Strategy Team, we have a hub in Bonn, although I'm based in New York for now. But the Mental Health and Wellbeing Strategy Team is almost the coordinator for the mental health and wellbeing resources. We work very closely with the staff and stress counselors system-wide, and I'm sure my colleague Tanos will touch upon that. And both those groups provide invaluable support, supportive resources to staff across the board. You should also know that we have a healthy workforce platform, which houses a number of our like physical resources. Can you see this screen?
No, Lena, you have to take the presentation out of full screen to see now the link.
Oh, okay. How do I do that? Okay, well, maybe I'll come back to it.
The link is in the chat.
Yeah, the link is in the chat.
Perfect.
Yeah, okay. So just to let you know, there is the Healthy Workforce website that contains various resources such as the mental health strategy, a summary explainer of it. We put together a video I think it was beginning of this year, explaining really in, I think, three to 4 minutes about what is the mental health strategy. And that in itself can be utilized as an engagement tool for staff to really understand the strategy in basic form. There is information for managers and leaders within that website as well, and other resources that will be relevant to transition and change. So I shall hand over to my colleague Tanos. Do you want me to continue? Do you want me to help you manage the slides, Tanos?
Yes, and then I cannot take control, so please
sure.
do.
Okay, so over to you.
Thank you, Nena, for the presentation. And I'm coming from the other side of the coin. I'm a staff counselor working for the UN system now for 6 years. I started with WHO, and the last almost 3.5 years, I was participating in the steering committee of UNSCG. And what is this UNSCG? About 25 years ago, the first 6 first counselors, stress counselors, staff counselors in the UN system decided that it's not really working being in isolation, and they had their first meeting, let's say. It was not a formalized official meeting, but they came together to see how they can first and foremost support each other, because someone could be in South Sudan, someone responded in an emergency in Haiti, and there was no formal network for that. After many years of trying to formalize the network, finally in 2010, the network was finally established under the HR network. And since then, we are meeting on a yearly basis, but most importantly, we serve as a technical body of mental health professionals to provide support, to provide advice, to provide guidance, and to not only help each other inside the UN system, but also collaborate with external stakeholders, with HR professionals, with the mental health strategy group, with the ombudsperson network, and with any other stakeholder that form this response when it comes to mental health and well-being. And as Nena mentioned very well, it's a multidisciplinary approach. You saw the strategy. We are just one part of the implementation process. We provide the individual support inside the UN system, but we are also involved in all the other areas of the strategy implementation. Next slide, please, Nena. So, as I said, what we're trying to do is to build internally. We have produced a number of papers for the professional standards in order to have a baseline for who can be a staff counselor and a stress counselor inside the UN system. We have a confidentiality paper. We have our ethical principles, and we are trying, to put the quality assurance element in everything that we're doing. But most importantly, and considering the right crisis and what is happening now, we're trying also to develop position papers and guidelines on how to support our colleagues, the people who work for all the entities and agencies. Next slide, please. The community, who belongs to us, basically is all the staff and stress counselors in the United Nations system. But for our steering committee, we have 11 permanent members from all the big agencies, which basically are those who came together at the very beginning, and that throughout the years we have identified that it would be useful to have representation in the decision-making process. So you see here all the big agencies are having a place in the steering committee, and we also have 2 elected members from the wider community that can be represented also in the steering committee. And we have a space for what we call other UN agencies. So we have a representative who represents all the smaller UN agencies, and even if they don't have a staff counselor inside their system, we want to have their voices and to hear what is happening and what are the needs and how we can support. And we have also a number of task groups and liaison groups, and we collaborate with the UNMD's network, with the Ombuds network, HR, and recently with the development of the guidelines that I will show you, we want to have a specialized also communication with the representatives because we think this is extremely important. I know that this is happening on the individual level. Like when I joined in WIPO, the first week I had the first meeting with the council here. When I was working before in WHO, I had monthly meetings with the staff representatives because we are working on the same issues most of the time. We get referrals from the staff representatives, and we very often refer people also back to them. Next slide, Nana. Now, the most recent guideline that we produced after having a request from the HR network, it's the technical guidelines on supporting mental health and well-being during organizational change. And basically, this was requested from us at the end of last year, before knowing what's going to happen in the next few months with the economical crisis and the UN reform. And we start having a working group dedicated working on the guidelines. We started by having a theoretical framework around it, and we thought that we need to support everyone who is impacted. And of course, as a priority are those people who might lose their jobs, who might experience the direct impact of what is happening. But we should always consider those who are left behind, either managers, colleagues, supervisees, the teams that they are affected in a very significant way. And we have provided different examples of different interventions that we can provide to all these different groups. We thought also that we need really to highlight how important it is in this time of crisis to have ethical leadership and putting the individual in the center of everything that we're doing. And for that, we need clear and transparent communication. We need to know what is happening and to have a very clear structure around what we need to expect, what will be the support available, what will be the outcome of any intervention and everything that is happening. We also need to think about how to strategically approach the situation, because we need to think about the sustainability of the work that we're doing. And all this, again, having in mind the individual, the person that they're facing these difficult times. Next slide, Nena. Now, the role of the staff counselors in the UN system is, of course, to provide the individual and, in many cases, group support. This can be in the form of counseling, it can be in the form of critical interventions or trauma-related interventions, and very often we provide preventative stigma reduction sessions, psychoeducation sessions. We're responsible for the supporting also the organization. So on the one hand, we have the individual support, but on the other hand, we also have the organization, the teams, and we provide all the sessions. We need to care also about our managers and leaders, and you saw that this is a big element in the mental health strategy. First and foremost, we have to recognize that these are human beings as well, and the higher you go up the ladder of responsibility, they are more isolated and they have less opportunity also to share and discuss. But another big element there is that we want to stop things from happening in the first place. And because these people have extra responsibilities, by educating them and giving them specialized tools on how to support others and how to care about mental health of employees, we believe that this can put like a very nice buffer and layer of support to all of us. And during times of crisis and on the phase of recovery, we are responsible also for supporting the teams going through these challenging situations and how to reform in order to be able to deliver and do their duties. And also we are very often act as advocates of mental health, of well-being, with policies, with HR colleagues, trying to influence the organizational and interorganizational level. Next slide, please. And just a reminder from the guidelines I will share here with all of us that in times of change, in any kind of transition, in any time of turbulence, mental health, as with physical health, is everybody's business. It's not just only the staff council or only HR to take care. It's every single person in the organization that can do something. And you being in the staff representation, you know that people are coming to you not only for asking for solutions, but you need to provide support. You need very often to calm people, to hear their concerns, to diffuse situations, and we can all together make a difference. We cannot really have one size fit all approach. Every organization is different, every situation and every individual is different. So we need to take that into consideration. Again, we need to stress that open and transparent communication is pivotal here. We want to know what is happening. We want to have proactive information, and we need to be able to collaborate, to form partnerships, and to care for each other. Now, just a final note on the guidelines. After publishing the first version, we said that this will be an alive document that we want to update regularly, and we received feedback initially from the Ombuds Network and the UNICEF, your colleagues. So we are now in the process, after also having exchanges with the legal and HR entities in the secretariat level, to produce the version, the second version, the update version. So I can share with all of us the first version, but you should know that this is very, very not likely. It's changing in the weeks to come, I would say. Thank you very much, and I think we open the floor for questions.
Thanks,
So you can use the chat for your questions, or raise your hands and just talk. I saw that Lucia has arrived too. Please, Wadzi, good morning. Good afternoon.
Good afternoon. I just wanted to thank Nena and team. And I do have a question. We've been asked a lot about how staff can speak to, sort of their managers or the people who supervise them, to explain that they are having difficulty, right? So if you're afraid of someone, what sort of tools can staff use to be able to have that conversation that's so difficult for them, especially if they feel at this time, they feel like saying that I have a mental health problem can actually put me in kind of the firing line, quote unquote, or it can show that I am not, I'm not strong, I'm weak, and things like that. So this is what we're coping with. So there's a great deal of fear, right? And staff are unable to articulate. However, they're being asked to do more with less. They're being asked to almost do the impossible. And each time you kind of try and push back or you say, I can't, you're told, you do know that there's no money or there's no this and there's no that. And so you're kind of gaslit when you're trying to follow even the things that have been said about mental health and all the pamphlets look great, but in practice, when you're trying to put it into practice and you're trying to push back as a staff member to say, listen, to tell a supervisor who maybe in their culture mental health is not a thing. I always say I come from Zimbabwe. There's not even a word for stress, right? So if you say to your mom, I'm stressed, she looks at you like, you know, I come from a culture where women are meant to be strong, right? Women are meant to hold stuff together. I come from a culture where you dress up and show up no matter how bad you're feeling, right? And so imagine that you're telling somebody like that, or who comes from a culture like that, that I'm not really great right now and I'm not coping and I need help. And it'll immediately go in the supervisor's head going, okay, so you want to get time off or you want flexible working or you want, so how can staff practically be able to have these difficult conversations? What are the tools that you have that can help staff do this practically, right? Because it's great to have these strategies and it's great to roll out these strategies, but these strategies, the scorecard is for HR and it's to inform HR. The global staff survey is to inform human resources, right? But what is there that staff can use to help themselves and to help and to be able to have the words to have these difficult conversations? I hope that makes sense. Does that make? Okay, thank you.
Yes, it does make sense. So, Wadzi, so I'll give a first shot at it, and then maybe my colleagues might want to add to that. I think what you've raised is an important one, and it's something that I hear a lot in the course of my work. Staff often deliberating about how they share with their manager that they need time off. And I'd just like to emphasize that there's no obligation for a staff member to say why they need time off, because it's within their right to go to the manager and say, I just need to have time off, or to take, like, for example, uncertified sick leave. Staff can be supported in various ways. So the new, in terms of resources, the new Lead and Learn 2, which is designed for managers, has part of it, some coaching guides on how to have difficult conversation. It's designed more so for managers, but I believe it can also be used for staff. And it covers things like the whole emotional regulation, how to sort of like understand what's going on within you, and some prompts there to really begin to have difficult conversation. So that, I think that's a valuable resource that staff can use first and foremost, to be able to know how to even start off that conversation. And then as a manager, it may all, because managers are also staff, they may also utilize the same resources to have to have similar conversations with their team members about mental health related concerns. I think another resource is also the valuable role of the staff counselor's office as well, which they can provide support in supporting the staff member, in giving them the prompts on how to have those initial conversations. There's also the ombuds service as well. I know they provide in other entities where I've worked, the ombudsman service can also provide some coaching or be offered to be part of situations where the staff member might need that additional support. But I think it's a difficult one, because without the psychological safety there, or understanding all these cultural dynamics, it's always going to be a difficult area or issue to broach, particularly in a time where we're dealing with limited resources. And then for you to say, oh, by the way, I don't feel very well, I need to have time off. And you're right in saying that there's going to be all sorts of responses there, like how long is the staff member going to be off to? So I think we have the obligation to really encourage staff members that it is within their right to have that time off, but they may need some coaching to be able to have that initial conversation. I don't know whether any of my colleagues might want to add anything.
Nena,
Lucia, welcome.
Sorry, just before you add, we've got small organizations that may not have a staff counselor in their organization. So where can they go for that sort of resource? Because at FICSA, we serve a broad range of organizations. And even like Christina comes from a small organization. I come from FAO, which is a bigger organization, so we do have this broad swathe of organizations who may not even have access to ombudsman, may not even have ethics, may not have a counselor. So this is the sort of thing that we're looking for. Can they come to you as the hub? What can they do? Over.
If I can answer very quickly that part, you can reach out to UNSCG, you can reach out to Nena. We will find the available support. Even if it's a very small organization with no staff counselor on site, we always work as part of a team. And very often in the field, because before I was working and I was supporting Middle East country mainly, with all the emergencies, all the staff counselors were like, I have someone in Yemen right now. Do you have someone on the ground? Do you have someone who can support with Arabic, with, Swahili? We will find what we need. And as a general umbrella of services, we have UNDSS, the CISMS service, which they are responsible for taking care of all the staff, especially following critical incidents. But again, if they have a staff counselor on the ground, or sometimes they have trained mental health professionals, they always provide the support. And I don't know if you want to add to that.
No, I think you've covered everything. And I think it's also good that you've mentioned about the CISMs, the Critical Incident Stress Management section as well. So they are available to provide support in terms of crisis. And they also have a list of stress counselors that are scattered around different regions as well. So, yeah.
There is a question in the chat. Can you see it?
Someone says that, yeah, this is true that most of the times the support is on the regional offices and not country offices. As Nena just said, UNDSS has the regional staff counselors covering the different parts of the world, and all the big agencies, they also have the same system. But many agencies, including UNDSS, CISMS, the Critical Incident Stress Management Unit, they have also country-based staff counselors. Maybe not in every country, but in many countries. We need to highlight that also we are affected by what is happening, the staff counseling teams, and many colleagues, many people have lost or they will lose their job. Some teams are 50% in reduction right now, but still we are coming together. So the most important things, and what we always say to people, is to come forward to ask for support. And I've never seen in my 5 years in the system someone refusing. To the contrary, I've seen people go beyond what they can to have an individual session to offer counseling, because we understand that this is the main reason that we are here. And just going back to the first question, of course, we've seen it again and again. And in country offices, in regional offices, people might be afraid, people might have supervisors who have no knowledge or sensitivity around mental health. And this is very, very often the case. That's why our individual support is completely confidential. We don't report outside of what is happening in our offices to HR, to management, to security, to medical even. It's between us and the individual. Because ideally, we would like to, support and change the system and the teams. That's why we have this strategy with so many different pillars. But very often, what we can do is to support the individual. We might feel something very small that, we cannot change the system, but sometimes this is the reality. But even supporting the individual to be able to feel more empowered, to feel that I have a safe space, that at the end of the day I can go, I can discuss, I can take support. This can be something very big in the long run, and especially with smaller organizations or in emergency duty stations. This can really make a difference in someone's day-to-day experience. Over to you, Christina.
Thank you so much, Thanos. Yes, I'm very surprised. We are not receiving many questions. I encourage everyone to ask something if they would like to, and yeah.
And Christina, maybe we can also let them know that we've had an Ask the Fixer session around ombudsman. We had the ombudsman from the UN Secretariat. It's on our website. We've spoken about ethics and understanding ethics. So a lot of these resources are on the website. I think one of the reasons that people are quiet is because it is very hard to speak about mental health, right? And it is very hard because you can see our names to say, look, I'm struggling. So I'm going to ask the questions for that people may be thinking, or maybe really having a hard time. Another issue is women in menopause and mental health. So this is a huge one. It's a conversation that's just starting. A lot of resources are starting to be made available. I'm a woman in menopause, hot flashes, mood swings, Lord knows what else is going on, my body changing, all of that. And I think one of the things that I speak for myself as a woman, is that it's very difficult for a woman to speak up because of the perception of women being, we've always needed vapors and we're always fainting, and this image of the woman being the weaker and etc. And then we have member states who think women shouldn't be in the workplace anyway and should be home. I mean, one of the member states literally said you should be barefoot and pregnant, or why are you here challenging me type thing. So I think it's quite difficult. So do you have women-friendly spaces, right? And I just don't speak for women. I speak for people who are LGBTQ+. Are there spaces for women, for minority groups, for women, where they can have the conversations around very specific fears that they may have, which may not be fears that the broader community have? Because it's so much harder to be part of a minority. It's harder to come up with issues that you feel are very specific to you, but once you speak to someone, you actually realize they're quite universal. So are there any of these safe areas that people can have a chance to be in a safe space to communicate? Another question I have is, are there any groups that you run as the counselors that virtually people can, pop into? on various themes, like a community of practice on various themes. I'm HIV positive, so I tend to like to find spaces for, people with HIV, people, because that's a stigma-related disease, and it's also a mental health issue, because generally when you have HIV, you tend to have a tendency to have more depression. So Tirius heads the Disability Inclusion Network in Vienna, and we know that there's a lot of parents who are staff with children with disabilities who burn out just because, they never get time off. If you come from work and then you have to go and look after your child, there's never a switch off. A lot of them don't even take their holidays because their holidays are used for their children. So do you have any sort of special interest groups within your net? And I know resources are stretched. I know that, even staff counselors are being retrenched, etc. So I know it's a big ask. But by the same token, is it something that staff representatives can help with facilitation from staff counselors, and with help from staff counselors to help us have the right words, the right, how do we create safe spaces? How do we create safe spaces within our organizations? How do we attract people to come and speak up so that we can help people better?
Thank you, Watsi.
Thanks, Wadsi. Certainly at the Secretariat, I know that I'm not aware of any safe spaces, but I know that there are some agencies that perhaps do have these, but I'm just not aware of it. But maybe that's the point for me to get to know more about these groups, because it could really help us, particularly in advancing areas of the strategy such as stigma reduction and the whole participation aspect of the strategy. But as you were mentioning about menopause, it reminded me that I think it's this week, one of the CISM's critical incident stress management section stress counselors has been delivering some of these trainings recently, and I think it was well attended, but I think it was specifically to UN clinics and UN women. So, and her view would be that it's something that should be offered across the board. So that's what I would say from that. Lucia, did you want to jump in and say?
And hello, everyone.
Yes.
I don't know if you can hear or see me. Okay, hi.
Can hear you. Yes, yeah.
Yeah. So no, just to build on your point, Nana, we as the MHS team, we don't have these spaces. We are a very small team of 3 people, but we do collect information about what's happening across the system, right? And through the scorecard, which it was mentioned, it's a very bureaucratic exercise, I would say, but it's very useful for us to collect the information. So we are aware that such spaces do exist at UNDP, if I'm not mistaken, at UNICEF, at UN Women, and UNFPA. So this relates to the work that we do under the stigma reduction pillar. So we do collect information about that. We know there are some safe spaces, interest groups where colleagues can gather and discuss items and thoughts of common interest. But I think we should explore further and see how, what is available, at least have a concrete mapping of what exists out there and is in the full spirit of the strategy, right? So elevate best practices, make sure they're known and they can be replicated within other agencies that don't have such groups. So feedback taken. Thanks, Watsai.
Thank you very much. And anything that you can share with us as FICSA, we will then disseminate. And anyone who's here who has a practice or has set up a special interest group, please share it with us, and we'll share it with the mental health team, so that we can truly kind of, utilize the resources we have which may not be as abundant as we would like. But I think the more we can have pockets in places, especially in places where staff feel isolated and are alone, right? Duty stations where people, it's one or two people in the middle of nowhere. It would be really important for their mental health, for them to feel like they're seen and they're heard. And I really reach out to staff, and we've got quite a few here in the field who are online, to keep us posted about any other either issues that we're not touching, or or best practices that have worked for you, that we could incorporate into this experience sharing. I'm actually right now chairing the stigma reduction working group, and we're going to find out how staff feel about stigma. So we are making as much, we are gathering data. However, we don't know what we don't know, right? And it's so important that staff reach out and let us know, so that we can help Nena and her team help you, in a sense. And we can then also communicate to managers about best practices that they could start in their own organizations that could help. So anyone with any ideas, anything that could help, please speak up, so that this is really for you. I mean, it's for the members, it's for you to tell us. And here you have the listening ears of staff counselors, So it's really important that you come up with your questions or your suggestions. Over.
Thank you, Watsi. And first and foremost, I want to thank you for the trust and for sharing your different personal worries, plus and identities and concerns, and caring for other people, because I can feel that you're so generous around how to support others, and that's always a great quality for someone to have. And again, we need to look first internally in our organizations. Like when I was with WHO, we had the Disability and Inclusion Special Interest Group that very often I was with them, and we had some group sessions. In Afghanistan, the colleagues from the UNDSS, the Secretariat, and those who were based, I know that they were having weekly or bi-weekly women's awareness sessions, females only group, especially what happened after the Taliban took over, and it was very difficult for females to reach the base and work. We have UN GLOW, which is the UN umbrella organization for all LGBTQI plus individuals, and in different cities, in different areas, they provide different initiatives, from support sessions, but also for social events. WFP has introduced many years now, I think more than 5, the FLOC program, which is a program supporting families, WFP families, but the program is open for other agencies also to integrate. And I know that some agencies, and in some countries, it doesn't have to be on the global level, they are piggybacking on that. Many staff counselors provide support groups, and this can be also online, because sometimes we have to think on the other side. It can be dangerous and risky for individuals to go very open about this kind of support, especially in some countries. So there might be things that they are happening, but not necessarily be widely advertised. And again, that comes from my experience in Cairo and in other countries in the region there, that we could not discuss about these things openly and have a banner to advocate about it, but we were having informally and a bit under the radar this kind of support sessions. And the people who want to take the support, usually they find the way to take the support. What else I want to share? I think, yeah. And for the menopause that you mentioned, UNDSS CSMS, they did something. I'm sure that also, I remember Annabelle was doing something in the secretariat here in Geneva, and I saw that a colleague put her name on the chat. So that can be another resource. And I will also write now the UNSCG email. You can write also to us, or vice versa, Mental Health Strategy Group the same, and we can gather all these initiatives and we can try to see what is happening in the system and feed it back to you to disseminate.
Thank you so much. I know that in some countries it's actually dangerous to state that you are LGBTQI plus, right? I mean, in my own country, it's legalized. It's legally wrong to be gay. So you know, you can be thrown in prison for that. So yes, it's a lot of issues, and I think a lot of it has to do with the support for staff, especially for staff with children with disabilities. I think this support is very limited. And if Sotirios could maybe describe how he started the Disability Inclusion Network in Vienna, because that's an experience that could be shared with staff, and they could start, other staff representatives could share that experience, and it would help other, you know, some of our other members understand that locally you can create initiatives that, you know, you don't always need a corporate response to creating initiatives. Over to you, Sotirios.
Thank you, Watsi. Thanks, colleagues, for the wonderful presentation. The details I was following till now. It's really interesting. Yes, Watsi, you had the point that I should describe a little bit what we did. Although, of course, now the topic of disability, it is touching mental health as well, because it gets us under stress. But at the same time, it's a separate topic. But I can give you, of course, the experience of what we did, because we created a group here in Vienna of colleagues who are affected by disabilities, either directly or indirectly through dependents like the kids. You said it correctly. It's not always necessary to wait for an initiative coming from above. Sometimes it's the right thing to start with a bottom-up approach, to just organize yourself. And in some areas, like Thanos brought it up, it might be even the only way of doing things, because if it's not allowed in a certain way in the country that you are, you have to organize yourself, and you cannot do an official thing from above. We have experience of similar networks like ours as well, who did bottom-up approaches and were very successful. Speak about Dutch colleagues who did it within the Ministry of Foreign Affairs. A disability network which is worldwide, but just within the Dutch government. While we here in Vienna are cross-organizational, but at one site in Vienna. So it's several organizations in the headquarters here. For us, I can say that we are planning to open up. So we will in the future be able to assist other colleagues as well from outside of Vienna, but in a different framework, because our main thing, what we are doing, is peer support, and this is mostly possible only, you know, for colleagues who are here. I cannot help somebody who's on the other side of the world with questions like the right doctor, the right school, and so on, you know, for dependents. But in general, it's wonderful that you allowed me to speak a little bit about our network, Vatsia. In general, we are facing similar issues, and the disability topic is a mental health topic as well. And it is imperative that we all try to find creative ways of how to support the colleagues, not only waiting for things coming from above with official frameworks. They're wonderful, they're necessary, but at the same time, we have to be sometimes creative and just support the people where they are and in whatever situation they are in the best possible way. And we are, of course, now a network which is just volunteers, so we are not being paid for it at all, or we don't get any time off. But it is incredible sometimes what a group of colleagues can get done, you know, if you are just motivated enough, changing things. And what I can proudly say already now, after the 3 years of existence of our network, we managed to change the culture already here in the headquarters in Vienna. We have the support of DGs and executive secretaries, open support. This is already a very big thing. Once you said it, in a lot of cultures, there are areas and topics that are not being discussed openly, and disabilities is one of them. In some countries, people with disabilities just are not visible because they're locked away, you know, like it was even in Austria probably 70, 80 or 100 years ago. So if I have a colleague from there in the middle management, for him it's very difficult to understand some topics that we bring up. And the main thing that we just want as a person affected by disabilities is just to be able to perform our work, nothing else. And a little flexibility for all these, you know, things that are affecting us so we can perform the work correctly. And the same applies probably to all the colleagues who are affected by mental health issues due to the stress that we are facing. In reality, they all just want to be able to do the work and not to be, you know, and to have an environment where they can do the work. And it affects, of course, the same way for the other groups as well that we brought up. Yes, that's what we are working for. Thanks again for allowing me to present the network, and handing over again to Watsi.
Thanks, Sotirios. I think Christina is actually chairing. I just took over. Sorry, Christina.
No, thank you. You were very supportive, and you have always fantastic inputs and ideas. So we have reached 3 hours. I think we touched a lot of important topics, and we gave many good advice. I hope that so I will encourage again, if there are some questions, to put them now in the chat or to raise their hands. We could have another other minutes to stay in our meeting here in our session. So, but if not, yeah, thank you, Sotirios, of course. I'm continuously in contact with him. So nothing. So nobody has any question. You are free, of course, if you have questions when the session will be over. You can send them to our address, to FICSA, and we will forward them to those who can have an answer, and or we will be, if we will be able, we could answer ourselves. And so I thank everybody here: Lucia, Nena, Thanos, Wadzi. What would like to say something else? Thank you.
No, I was just going to say, as part of the mental health and well-being implementation board, FICSA is part of that board. And there are various groups on that board. And so there's groups dealing with the training and capacity building aspects of mental health. There's groups dealing with things like insurance and understanding insurance for mental health. There's groups looking at, the actual scorecard and how to improve it and what to include, and et cetera, et cetera. And as I said before, I am the rotating chair for 3 months for the stigma reduction group. So the mental health is really looking at various aspects. And Lucia, maybe you can give us all the groups we're working with, because I mentioned 3, but I can't remember the others. But I think the important thing for staff to understand and for our members to understand is there is a cohort of people who understand what staff are going through, and they are staff too. every single one of the members of the, the therapy groups, etc., really, they are not management as such, because they're coming from the therapy and the practice of, counseling, etc. So they really do challenge the human resources, and they do challenge the practices in place. And things like flock, which Thanos mentioned, are things that we are saying, why can't that be made available across the board? Because we don't travel just as staff by ourselves. We travel with a family, and families are as isolated as we are. And we are expats. We are foreigners in a strange land. And so we are saying, if you could have these initiatives rolled out. And so what we're asking staff representatives is, please engage with the councillors in your area and have conversations, so that, and then bring it all, and we will, gather the resources and share it with Nena and her team, so that we can be effective. It's pointless to have these conversations and then there's no action, because I'm very much what is the pragmatic way forward? But we need staff to tell us how we can help them pragmatically. It's pointless to me saying, okay, start a group in Zim, and then that you'll be raided by the cops, because they'll know that, there's LGBTQ people kind of, this is where they're hanging out, and I've just, endangered your life. Because also the danger of advocates like me and activists is that we're well-meaning, but we don't have the actual skill, right? Which is why we ask people like Nena to come in and provide us with kind of like the chapeau, the umbrella. So anything that staff and staff representatives can reach out for assistance, please do. And I'll hand over to Lucia to tell you the different groups. But there are initiatives out there, and we use these Ask the FICSA Expert sessions to inform staff, so that you don't feel isolated, you don't feel, and what I love is that FICSA is on the implementation board. FICSA has a voice. So we are speaking to the managers directly. We're not going through, somewhere else. And so we're heard. Over. Thank you.
And this
Thanks,
is
Watsi.
fantastic. And I just want to add that, as Sotirios was saying before, there is the organizational responsibility, there is the duty of care, all these, and we need to keep fighting and advocating and improving them 100%. But there is the individual responsibility as well, and we have to take that into consideration. Mental health stigma, they go hand in hand, but we can do little things to break that. I was telling them when I was sitting in Cairo, you're not going to see a clinical psychologist to have psychotherapy about, I don't know what happened to you. If you act like that with a counselor, then we're losing the game. Go to your staff counselors, ask for sessions, ask your manager about available resources, challenge them in a way not to create a conflict or a fight, but throw the ball back to them. You have children, you have families, you have relatives. You can visit a counselor asking about your child, about a friend who is suffering from something and you want to take advice. We should not be afraid or intimidated saying that, I visited a staff counselor, or I had a discussion with Nena, or I called Lucia for resources. It should become part of our day-to-day experiences. And that's the only way to break stigma and to normalize asking for support. Thank you, Watsi.
Watsi, to respond to your question, I think Nana posted in the chat the list of all the working groups within the umbrella of the mental health strategy. I'm going to say just a few words for each, so colleagues who are still online can make sense of it. So the first one is on mental health literacy. The working group developed a program, a mental health literacy program that is already available online, no cost. There's a presentation, it's going to be a dialogue on mental health literacy that we are offering all the organizations to use, and we will be training the facilitators. We will be launching the trainings in September, so that for October, which is for mental health month and day, depending on the organization. We want really to offer these trainings to all teams across the system. This is a very basic course on mental health literacy. So what do we mean by mental health in the workplace, common signs of poor mental health, and how to respond, etc. So this is the first product of this working group. Then you mentioned it, the stigma reduction working group, chaired by FICSA currently, co-chaired by FICSA. And we are, the working group is working on really how to get data on stigma, which is very hard. And we, through the scorecard, we know is not done properly across the system. So we really need to focus on that and then start campaigning for stigma reduction across the system. Then psychosocial risk, that would take at least an hour to explain. We are launching an interagency system-wide project on psychosocial risk management. It's starting now with pilots in few organizations, and this is really to assess psychosocial risks in the organization and to manage them. So have in place a plan, a mitigation plan to take care of psychosocial risks across the system. It's coming. Then the insurance working group is a roundtable of experts, insurance experts across the system, across the board, who come to the working group, and really we are focusing on barriers to access mental health coverage within current systems, insurance systems, and we are again sharing best practices and offering a space for organization to compare and see how they're doing about that and see if they can learn from each other. Unfortunately, we cannot really change insurance systems and agreements that are already in place, but we can share knowledge and hopefully plan for some minimum services that are guaranteed across the system. The family support working group, really looking at how families, staff members, families are supported throughout the work life of staff members, from recruitment through change of duty stations to everyday life. So the FLOC program exists. It was developed at WFP and is offered across other organizations. And our aim of that working group is really to make it available across the system, either as a FLOC or developing a new interagency cost-shared function that can help organizations, families of staff members. Then we have strategy and policy. We are here, this working group mainly looks at policies and rules and how they feed into the strategy, into the mental health strategy, to give direction and to make sure mental health is not just a small pocket within organizations, but is widespread across different pillars within each UN organization. And then this last one, in the context of the UN 80 and changes that are ahead, we are really brainstorming and see how the mental health and well-being services will adapt or will look like in the future. We want to be ahead of the change, and so we have a group, quite a big working group right now. We are about 20 colleagues across the system who are brainstorming and proposing ideas on how ideally mental health services will look like in the UN in the next months and years. And that's a very high-level summary of what we're doing. Again, if anyone has questions or would like to know more about the working groups or anything related to the strategy, there's an email there. We're happy to chat about it. I also posted a short video, an explainer. I don't know, Nana, I missed part of your presentation. I don't know if you showed the video already, but in any case,
I just referenced it, but it's good that you've posted it there. Yeah. So.
In any case, it's there. And yeah, and that's it. Over.
So anyone would like to add something? Okay, Miguel, please talk. Miguel Ubina. You raised your hand?
No, it was, I only wanted to say yeah, thank you for the good information. It was not a question, was my fault, sorry.
That's okay. Don't worry. It's nice to hear voices and not
Of course.
only icons.
Thank you for all the information. It's great to have all these people sharing the knowledge and the resources. Great job.
Thank you. So thank you, all of you. Thank you for the huge work you're doing and the time that you are giving for this mission. We are very proud of you, and thanks for being supportive to everybody in the UN, and surely not only to those who are in the UN. So I think we close this session. Again, if any questions arrive later, we will be happy to reply. Feel free to send to FICSA the questions. We will give them or forward them to the Mental Health Implementation Board. And we hope to see you in our next Ask the FICSA session. We, as FICSA, we do everything we can to help members and UN staff to live their work experience in the best way as possible. So thank you, everybody. Thank you, Nena. Thank you, Thanos. Thank you, Lucia. Thank you, Wadzi. And au revoir.
Thank you so much for this opportunity and the information that's helping us to do our job better. So it's much appreciated.
So,
thank you, and have a great summer for those in the Northern Hemisphere.
Thank you, Wadzi.
Thank you.
everyone.
Bye.
Thanks,
Bye.
colleagues.
Thank you,
Bye-bye.
everyone. Bye-bye.
Bye.
bye,
Look
bye,
after
bye.
yourselves.
Bye.